Hello friends, in this video we are going to see how to handle biometric exception in AADHAR. There would be instances where a resident would not be in a position to give complete set of biometrics due to reasons such as injury, amputation of fingers, hands and similar problems with the eyes. The following guidelines are to be followed while handling such exceptions. For missing, amputated, bandaged finger problem, the exception must be explicitly marked in the software, along with exception photograph and the fingerprints of the remaining fingers are captured. When capturing iris image is not possible due to non-existence of one or both eyes or bandage across one or both eyes, any other deformity or disease, the same has to be recorded in the system. For squint or disoriented eye problem, the exception must be explicitly marked in the software along with exception photograph. If there is an exception in one iris, the second iris must be captured. Supervisor is required to sign off every enrollment on AADHAR client where a resident has a biometric exception. Now we will see some biometric exception errors. No exception available in exception photo. An enrollment is considered as no exception available if the photograph of the resident is captured without biometric exception. However, it is marked as with exception. Object in exception photo. The photo for the exception should show a resident with his or her exception. If there is any object instead of resident photo, the enrollment process is rejected. Photo of photo in exception photo. A photo of a photo is not acceptable. The photo should have the resident in it. Poor quality in exception photo. If the image captured is of poor visibility and quality, then it will be rejected. Both photo of different person. If there is a mismatch of resident photo and exception photo, then it will be rejected. Exception photo not as per the guidelines. When the exception photo is not as per UIDAI guidelines, it will be rejected. Now we are going to see the software part in biometric exception handling. Click the biometric exception in the bottom of demographic screen to capture biometric exception. Mark the exception as per the resident biometric. For example, if the index finger of the right hand is amputated, mark only the index finger as exception. And let us mark left little finger as exception. If we mark right eye as exception, in the iris verification screen, only left eye is enabled and right eye is disabled. In respect of photograph, two photographs are taken, one normal and one with biometric exception. Sample exception photo is shown in the screen. In this way, we can capture biometric exception. So friends, let us have a quick recap. How many photographs are required for people with biometric exception? Yes, you are correct. 2 photographs are to be taken for people with biometric exceptions. One regular and another one with biometric exceptions. Friends, in this session, we have seen about biometric exception handling and some biometric exception errors. In our coming sessions, we will see about guidelines for enrollment operator and supervisor on quality of enrollment. Thank you.